Welcome to this edition of Take 10. I'm Sherry Carabin, and today we're going to be talking about mesotherapy, a non-surgical alternative to liposuction. I'm here in West Orange, New Jersey at Mesotherapy Associates, and I'm talking with Dr. Marion Shapiro. Dr. Shapiro, tell me exactly what benefits patients can expect to get from mesotherapy.
Mesotherapy is a technique where we inject the mesoderm, which is the layer right under the skin, and that is what holds the fat cells, and connective tissue. Mesotherapy's goal is to melt that fat under the skin so that in 10 weeks a woman can lose up to 2 dress sizes, or you can eliminate love handles, turkey chin, and other fat deposits in your body.
What is the difference between mesotherapy and liposuction?
Oh, there's a very big difference. Liposuction is a surgical procedure that requires anesthesia and downtime. It causes severe swelling. You have to wear restrictive garments after liposuction, and it's very painful. On the other hand, mesotherapy is a non-surgical alternative. We give injections to melt the fat under the skin, and the injections are basically painless. So week by week, we melt the fat to give you a beautiful appearance. Unlike liposuction, mesotherapy does not remove the fat cells, only the fat.
There's a benefit in that, though, isn't there? Because with liposuction, once you remove the fat cells, if you gain weight again, you're going to gain it somewhere else.
That's right. With mesotherapy, if you do gain weight, it will come back in the places where you had the fat before. So your body will return to its previous state.
It's also a good thing to use to get rid of cellulite.
Well, mesotherapy is the only thing that will rid your body of cellulite. Cellulite is connective tissue bands that are formed in the mesoderm and trap fat, causing a dimpling appearance of your skin. What mesotherapy does is it breaks those connective tissue bands and melts the fat to give you a smooth, dimple-free appearance.
With liposuction, this isn't possible.
No, and people should not have liposuction if they have cellulite because it makes the cellulite worse.
It does?
It does.
Okay. Now, if a person comes into your office and they have these injections, can they just leave, or what happens?
Well, basically they come in for about a 20-minute session, and yes, they have their session and they leave. We call the day you have mesotherapy the quiet day. We don't want you taking a sauna or exercising vigorously, but then the day after you can basically resume your normal activities.
Do you need to exercise to help make this work?
Well, only if you're interested in weight loss. For instance, if you come to me for spot weight reduction and you're in great shape, we just tell you to continue doing your normal daily activities. However, if it's your goal to lose weight all over your body, we encourage diet and exercise along with mesotherapy.
So you're not going to see pound loss on the scale from this procedure?
Exactly. Mesotherapy is all about losing inches because a pound of fat is 4 sticks of butter. Imagine melting 4 sticks of butter off your arm. Your arm would be very skinny, but you'd only lose a pound on the scale.
What about the cost?
Well, the cost of mesotherapy depends on what you're using it for, cellulite versus weight loss versus spot weight reduction.
What's the average number of treatments?
Well, it depends on your goal. If it's just spot weight reduction, you might need anywhere from 5 to 10 sessions. If you're looking for weight loss, it could be 10 and more than that. It depends on your goals.
Okay, and obviously insurance does not help you pay for this.
Well, unfortunately, mesotherapy is considered cosmetic, so it's not covered by insurance.
Okay, thank you, Dr. Shapiro. And don't go away because we are going to meet the patient. I'm here with Diane Grassi, who is about to undergo her 17th mesotherapy procedure. Diane, tell me why you wanted to do this in the first place.
Because I needed some help to get me started, to get back on a diet and all that. And this is non-surgical. So I wanted to try it for cellulite especially. And it has worked, so I'm very happy.
Now you've had 16, this is going to be your 17th. How many are you going to have?
Until I'm totally satisfied with my legs. So I don't know.
Well, where are you having it done?
Basically like on my thighs, in the thigh area, because I wanted to remove some cellulite. And that's something lipo doesn't do. And this is working. there's a big difference.
Prior to that, where did you have it done?
A little bit in the waist area because I kind of start to get that spread when you reach that certain age, and I didn't like it, so I had a little bit there. But it's mostly I was focusing on my leg area, hip area.
I went to France to get my certification in mesotherapy, and I was certified by the Society of Mesotherapists in France. But before that, I was an emergency room physician for 21 years, practicing in the state of New Jersey. I think there are only 8 mesotherapists currently practicing in the United States right now, but in Europe there are over 25,000 mesotherapists in England and France alone.
Why so few in the U.S.?
Well, mesotherapy is basically new to the United States, and I think now that people are beginning to accept mesotherapy, we'll see more mesotherapists. The problem with mesotherapy is that every mesotherapist has their own formula, and so there's no real consistency among the mesotherapists. There are doctors I know that use medication that's not FDA approved, and I only use FDA approved medication. So that could separate me from some of the other mesotherapists out there. There are people who say they do mesotherapy, but they're really just using one drug, which is banned in Brazil, and I don't recommend that you go to a mesotherapist unless you know what medications you're getting. You need to be an informed patient. Are you feeling any pain at all?
No.
How would you describe it?
You can feel something being done, but it's not painful in any way, and it just feels like maybe a trickle of water. I guess that's the medicine.
That's the medicine that comes out after the injection. And the needle is so fine, almost microscopic, so it's hard to even see it. The most amazing thing about this procedure is it's so unlike liposuction. You just come in for your 20-minute session and then you leave, whereas liposuction is a pretty significant risks involved, and you have to have anesthesia and you have to be out of work for at least 2 weeks. With mesotherapy, you'll be able to get up and go to work and do anything you want to do today. The most amazing thing is who has come to see me this week. I've been visited by several models and actors, as well as corporate executives, and housewives, and teachers, and people who just want to look better.